emerging from the shadows cast by COVID-19. That's the hope, at least, in Israel. The trajectory of the virus slowed, if not defeated, by the fastest vaccination rollout in the world. So fast, Israel is already offering them to anyone aged 16 and over, including Noya Rosenfeld.
I really wanted to because I miss spending time with my grandparents and my great-grandmother. And it was important for me to go back to life.
Operation Back to Life is what the Israeli Prime Minister Benjamin Netanyahu has dubbed it, staking his reputation, and with both a corruption trial and another election looming, his political fortunes too, on getting the entire country vaccinated by the end of March.
Bye, Corona.
Bye, Corona.
Netanyahu takes personal credit for a deal with Pfizer, the pharmaceutical company promising Israel a fast and steady supply of vaccines for an undisclosed fee and the promise of medical data on patients receiving them.
Israel is the first country to see real evidence that the vaccine is having an effect on numbers of the pandemic.
Scientist Aaron Segal says Israel is in a unique position to provide Pfizer with a database that could offer insights into the potential for a country to reach herd immunity. It already has a highly digitized public healthcare system and is small enough to remove some of the logistical challenges of a swift rollout. But it's not all smooth sailing. Infections are still stubbornly high in some quarters, thanks in part to the faster spreading variant first identified in the United Kingdom.
If it weren't for the vaccines, we would have seen a significant increase in hospitalizations and cases among the older age group.
Authorities have also struggled to enforce lockdown measures in the ultra-Orthodox community in particular. This was the funeral of a prominent rabbi in January. Vaccine uptake is also lagging in the ultra-Orthodox community and amongst Arab or Palestinian Israelis and young Israelis in general.
Risk perception among the young people, the risk is low for them. So this is why they don't think that they should get the vaccine.
Itamar Grotto says public health officials are looking at incentives to encourage people to get the vaccine. More freedoms during lockdown, for example, for those inoculated. He also says epidemiologists are urging the Israeli government to provide vaccines to the Palestinians.
The experts who give advice to the Ministry of Health, all of them are saying, and of course I totally agree, that this is an important both on the public health view as well as humanitarian.
The breakneck speed of Israel's vaccination campaign has opened up a heated debate over the country's responsibility towards Palestinians in the occupied territories, land captured by Israel back in 1967. Israel has offered vaccines to Palestinians in occupied East Jerusalem, and it's earmarked 5,000 doses of the Moderna vaccine for Palestinian healthcare workers in the West Bank, 2,000 of which were delivered in early February. Human rights advocates say international law obliges Israel to provide all Palestinians in the occupied territories with access to vaccines as an occupying power. Israel disagrees, government officials saying it's up to the Palestinian Authority to do so, citing the Oslo Accords of the 1990s that set out interim rules ahead of a Palestinian state that has never materialized. Dr. Ali Abed-Rabo is a director at the Palestinian Ministry of Health.
We, as the Palestinian Authority, asked through the WHO, not directly, that Israel as occupying force have the mandate to provide the Palestinian people in the occupied territory with the vaccine.
Russia donated 10,000 doses of its Sputnik V vaccine to the Palestinians, who are also waiting on 37,000 doses from the global vaccine sharing scheme known as COVAX. It's a drop in the bucket when you consider 3 million Palestinians in the West Bank and an estimated 2 million in Gaza. Some Palestinians say they'd rather their leaders not ask Israel for help. Others believe Israel will offer it in the end out of its own interest.
it is not going to be easy to contain this epidemic without taking care of the other half, because the borders are very close. So
About 130,000 Palestinians cross into Israel and its settlements in the West Bank for work on an almost daily basis when COVID restrictions allow, and some employers are lobbying the Israeli government to offer vaccines to those workers. For now, though, there's no sign of that. Israel has begun easing its latest lockdown, but health officials warn it's still a delicate balancing act, with infections still high amongst those under 40. And even those eager to get a vaccine know they might still have to live with restrictions for some time to come.
All the mutations that are coming and that we have, and so it's just really no one knows what's going to happen tomorrow or even later today.
The return to normal promised by Benjamin Netanyahu is still some way off. Margaret Evans, CBC News, London.